have the greatest job in the world, and that's working with dogs.
Best in Show winner is the French Bulldog.
Winston won the National Dog Show. It was amazing. It was exciting. And to have a dog to be #1 dog in this country, you have to have great nutrition. And I always fed Pro Plan. Just like us, when we eat well, we feel good. And I just love that food and what it's done all these years to all the dogs I've bred and all the dogs I've shown.
Welcome, you guys. Welcome to Pure Dog Talk. I am your host, Laura Reeves, and I am joined again by my dear friend, Dr. Marty Greer. And Marty and I decided we were going to have a conversation. Some people might call it a debate, but I think that's probably overstating the facts. I think we're
we're not arguing.
We're not
just
taking,
presenting two sides.
Right, exactly. We're not doing, and it was resolved. We're not doing that. But we are going to have a conversation, and it's kind of a conversation around breeding ethics and where's your line, right? Mm-hmm. So what's your line in the sand? And everybody has one. And we had our first Pedigrees to Pups seminar this last week. Marty and I did. We were together here in Southern Oregon. It was fantastic. And one of the things that I talk about in my part of the program is having a mission statement, right, for your breeding program. And I think this is part of that conversation that each individual person in each individual breed needs to have with themselves. So Marty and I were just having this conversation off air, and I'm like, okay, we need to do this as a whole conversation because I think it's really interesting. So I had a listener ask about a baby puppy with one testicle yo-yoing and one maybe not there, and you know, what should they do? And she said, well, there's only a couple things and it won't take very long, but I think that there's no reason not to breed that. And I'm like, wait, what? So Marty, I want you to talk to me about why, because this was a very interesting perspective that had literally never crossed my mind. So go.
All right. Well, for one thing, okay, so puppies' testicles should both be palpable in the scrotum by 3 weeks of age. That's the way it is. However, not every veterinarian and not every breeder has the same skill set to find the testicles, number one. Number two, Karma Battaglia, sometimes pronounced Battaglia, will tell you that women should keep their little grubby hands off of their puppies' scrotums because their long fingernails and their little poking around in there is likely to cause the puppy to pull their testicles up. So I think it's really important that you realize that not every veterinarian can find testicles. Not every breeder can. Not every judge can. I had a 6-month-old dog of my own, 6-month and 1-day-old dog in the ring with a judge who said, I can't feel the testicles. He was 6 months old. His testicles were both in his scrotum. They were both appropriately sized for being 6 months and 1 day old. He looked at my husband who had the dog on the table and said, I can't feel his testicles. Dan, with his big shovel hands, went underneath and said, they're both here. And the judge felt again and he said, I can't feel them. You're excused. Well, the guy was just obviously not good at feeling testicles because if Dr. Griffith's shovel hands can feel them, they're there. So, you know, really, I think it's important that you understand that from the beginning is don't throw a dog out of the gene pool if your veterinarian isn't skilled at feeling tiny testicles. I can feel them on my puppies that are 3 weeks old right now. I can feel both testicles, but Dan can't. The puppies are like, they're this big, right? But I can feel their testicles.
I couldn't find tiny testicles. I mean, and another perfect example, I had a very lovely dog that I bred. I found 2 testicles. My vet found 2 testicles. I shipped him to California. And my friend who got him said, I can't find his other testicle. I'm like, Leslie, I've lost a lot of things on an airplane, but a testicle is not one of them. Like, he had 2, dude. I don't know what to tell you. Right. And she never could. She never could find the other testicle. Nobody could find it. She passed him around to the dog club, vet, whatever. She sent him back to me at 9 months old. And I just looked at him. I'm like, you are way too pretty to have one testicle. And I reached up and I pulled it down. Voila, like magic. Now it was kind of shaped like a silver bullet, but you know, it was there.
It was there.
So can you talk us through a little bit of the mechanics of that before we go into the ethics? Talk about the mechanics because I think it's poorly understood.
Okay. So puppies are born with both their testicles right behind their kidneys during embryonic development, just where the ovaries would be and are. But in testicles, they should migrate down. There's a little gubernaculum, which is a little tissue that pulls the testicles down from where the kidneys are, down through the abdominal cavity, down through the inguinal ring, and voila, into the scrotum. Now, normally when they both show up in the scrotum, they're going to stay there. But when they're really young, they can hold them up. And when I check puppies' testicles, I check them really quickly. I don't let anybody touch them under the back end. When they pick them up, they have to pick them up carefully so their hand isn't between their back legs. I put them on the table. I reach from behind. That's the first thing I do during a physical exam on a new puppy visit when the puppies are 6 or 8 weeks old with the breeder, is I want to feel those testicles first. Then you can touch the puppy anywhere you want. I don't care if both the testicles are there, fine. And I have clients that come to us to say, my vet said I can't find that both the testicles, and I'll reach in them and go, well, they're here. There's nothing I need to do for you that is going to change that. They're both present, and they'll be like, are you sure? Yeah, I'm sure. I'm pretty good at this, but I can only do it with my right hand. I can't do it with my left hand. So I'm only a right-handed
I'm
palpator.
not even touching that. Continue.
So once they're there, they're almost always going to stay. It's a very unusual event that a testicle is going to disappear. Not unheard of, but
Yo-yo.
almost impossible.
Yo-yo.
Yo-yo's common. That's really common. But delayed descent in testicles can, so if you can only feel one consistently and the puppy's 4 months old, delayed descent is definitely predictive of the next generation also having an issue. So you and I were talking about, well, what does this really mean in a breeding program? And so we kind of expanded this into what are other things that happen at that first puppy visit that become an issue for the veterinarian that's looking at the dog to say to you, you should not keep this dog in a breeding program. So I think it's important that you know that, yes, you may have delayed descent in your next generation, but in my world, a retained testicle or a delayed descent is not a reason to throw a dog out of the gene pool. It is reason for conversation, but it is not reason for me to say automatically this dog needs to go away. So there's a few other things that we'll talk about, and that's my personal opinion. And we all have our own opinions. That's okay.
And I think it's important. I mean, we're going to keep going on this conversation because to me it was fascinating, but let's finish up on this testicle thing. So delayed descent, I know there are drugs that can be used. Do you advocate for or against those?
So there's a couple discussions about this. There are veterinarians who say they absolutely don't work. Absolutely don't. The first information that was published was in the Feldman and Nelson endocrinology book that I'm aware of back in the 80s. That was the endocrinology book that we were using when we were in vet school. And there was a study in there that showed 28 out of 30 dogs that had the injection of HCG given to them had testicular descent after 4 injections. I still have people and still use this drug, and I will use it. I used it on one of my own dogs, not because he was staying in my breeding program, because he had an ocular problem that was inherited. So there was no way he was going to be a breeder, but because I didn't want to have to go waltzing through his abdomen later on to find the testicle and remove it when he was neutered, because there was no question he was a pet. He was going to be neutered. But if I could keep him from having to have abdominal surgery to remove a testicle, I was all about that. So that's one way to look at it. Is there was research that shows that. There hasn't been anything published in the more recent editions of that book. And Dr. Feldman and Dr. Nelson are retired now, and so they're no longer contributing to any of the scientific papers. So I don't really know if we have any more information. Do I use it? Yes. Do I think it works? I think it works about half the time. And I think the closer to 10 weeks of age that you give it, their study showed that it could be given up to 16 weeks with some success. I think the closer to 10 weeks of age or younger you give it, the more success it will have. But we have no way to test if that puppy's testicle would have come down with or without the drug. So I don't really know. The other thing is this is human chorionic gonadotropin. It's given as an intramuscular injection. So number one, it's an IM injection and it stings like bloody hell. Every time I give the injection, I warn the client the puppy is going to scream. They're going to start screaming as soon as I give the injection. They're going to scream for 30 seconds, and then they're going to stop screaming and look at you like, I don't really know why I was crying, but because I'm okay now. It's that fast in onset. So I don't know if it's the salt content of the product or the pH of the product. I don't know what it is, but it stings. The other thing is it's a human hormone. So the question has always been, can the dog develop an allergic reaction because it's not a canine hormone, it's a human hormone? And when this question was asked at one of the Therio conferences, no one raised their hand and said that they'd ever seen an allergic reaction. And you know darn well a lot of the people in the room had been using it for a multitude of reasons, because HCG has other uses as well. So that's That's the HCG story. Is we don't really know,
Okay.
but it's worth a try if you're trying to keep your puppy off the table. If you're trying to keep your puppy in the show ring or in a breeding program, you have to be perfectly honest with yourself about whether that's appropriate or not. And it may be, and it may not be, depending on what other battles you're fighting in your line and in your breed. And that's where I personally score things on a level 1, 2, and 3. That's my personal scoring system, and we can circle back to that.
Yeah, we're going to do that in a minute. I just want to finish this up because I know this is a specific answer to a specific question. Short cords, how do you feel? I mean, is that really a thing? It's kind of a...
It is.
Okay.
It probably is a thing. And when we go to surgery to remove these,
physical massage, all that kind of stuff, does that...
no.
Okay.
No, because the cord is it's up in the abdomen. You can't change that with any kind of manipulation or massage. And when I take these dogs to surgery to remove the retained testicle, the cord is it's just short. That's all there is to it. Rarely will we find it wrapped around the bladder or something else. Those things can happen. And sometimes the testicle has descended and then something has happened to it. It's had some kind of injury or damage to it. And then it retracts or it scars down. I've seen them caught in the inguinal ring where they should come through and then go into the scrotum. I've seen them caught there. I've seen them pretty much anywhere from behind the kidney all the way to almost in the scrotum. And almost, close only counts in horseshoes and hand grenades. It doesn't count in testicles.
Yes, it does.
Trupanion is revolutionizing medical insurance for pets by providing the best possible experience to our members. And it's not some space-age dream. It's happening now. We pay your veterinarian directly while you're checking out, and we're the only ones who can, which means you have decisions in seconds, and you don't have to wait for reimbursement. So unlike with other providers, you'll keep more money in your pocket. Ask your veterinarian if Trupanion can pay them directly, because there's pet insurance, and then there's Trupanion.
Many veterinarians who see a dog, a puppy, a male puppy with a retained testicle want to neuter that puppy at 6 months old to prevent it from the testicle becoming cancerous. Thoughts on that?
So yes, the testicle, no doubt that a retained testicle has an increased risk of developing cancer because testicles were meant to be at 2 to 3 degrees below body temperature, hanging out in the scrotum. Yes, they are at increased risk. It doesn't happen when the puppy is 6 months old.
Right.
It's going to happen when the dog is 8 or 9 or 10 years old. So yes, the testicle should be retained. The retained testicle should be removed, but not until the dog has had the opportunity to fully mature and have the benefits of hormones. And that's a whole thing that we can talk about, the risks and benefits of spaying and neutering. Yeah.
Right.
So that's part of it. The other, I have seen 2 dogs in my career that have had a testicular torsion. So the testicle that's in the abdomen can twist, and it causes an acute abdomen similar to like an appendicitis if you're a person, anything that causes an acute painful abdomen in a dog. And it's serious because it is painful for the dog. But 2 dogs in 44 years of practice means
I had a testicular
not,
torsion in a dog that had fully both normal descended testicles. It was terrible.
Yeah.
It was really bad.
It is terrible, but it's easier to diagnose when they're in the scrotum because they're in front of you. When they're in the abdomen, you're like, what is going on with this dog? Because you can't find a bloat and you can't find a foreign body and you can't find anything else that's making them have this acute abdominal pain until you go to surgery and you find the testicle. So, I mean, 2 in 44 years. And I see a lot of patients, I'm a busy practitioner.
Yep. That's really good. Like put it in perspective sort of information.
Yeah.
So that covers the testicle question that came in, and so we wanted to address that. But then, as we were preparing for the conversation, Marty made the comment, "Well, just being monorchid isn't a reason for me to take him out of a breeding program." And I said, "Bah." And I said, "Well, I always thought that monorchid was because it was running down the bitch line because everybody took the monorchid dogs out of their breeding program." And you're like, "Yeah, no, that ain't happening." So. I just do your hierarchy because we've actually, I think off air somewhere along the way talked about this, but I think it's a really important starting place. When you've got your mission statement for your breeding program, you're going to have to draw lines in the sand, and then you're going to have to scuff them out and draw new ones.
Yeah. Well, and for one thing, we don't have a DNA test for cryptorchid or retained puppies testicles, and we don't.
You have fireworks behind you. What did you do?
I don't know, but it's pretty cool. So we don't
You guys
know.
go to
We
the
don't know
YouTube.
the.
You have to see fireworks and balloons on Marty's screen because it's just okay.
I can do
Anyway,
things.
go.
So we don't know the inheritance. We don't know if it comes just from the dog line, just from the bitch line. We don't know the inheritance. We don't have a DNA test for it. We just don't know. I have a client who believes that it happens more seasonally, sometimes of the year than others. Either's, we don't know. So the answer is, at this point, we don't have a way to determine the genetics of it. So the safest thing to do if you never want to retain testicle is to take them out of your gene pool. But is that the smartest thing to do? Because the dog may have other really important qualities that you're looking for in your breeding program. So I score dogs on a level of 1, 2, and 3 for genetic disorders. This is my scoring system. I made this up.
Mhm.
Nobody researched it. Nobody.
It's your mission
This
statement.
is
I
the
like.
world according to Marty Greer. Is, for me, a level 1 is something that you don't have a life-shortening, life-altering disease from. It's a retained testicle. You can find it at the puppy visit. Your veterinarian is going to find it. Your vet's going to say, don't keep this dog in your breeding program. And you're going to say, but. So you have to decide. For me, it's a retained testicle. For me, it's extra eyelashes. For me, it's an entropion. For me, it's an umbilical hernia. Because an umbilical hernia is not going to, in my opinion, not in Gerald Bell's opinion, in my opinion, is not going to be in a future generation causing something like an open abdominal wall where the guts are hanging out when the puppy is born. That's not related. I think it's a different set of genetics than the cause of an umbilical hernia. That's my opinion. So for me, the things you find at a puppy visit and they cause you to pause about whether this dog should stay or not has to be part of your discussion. For me, level 2 is something that requires chronic management long term. Allergies, thyroid disease, things that always need to be on medication. There's an ongoing expense. There's an ongoing thing that has to happen, but it's not serious. And for me, level 3 are life-threatening, life-altering, life-shortening diseases. This is my definition.
Mhm.
For me, that's bad temperament. If your dog bites somebody,
Mhm.
I don't think that dog should be in your gene pool. If I have to muzzle your dog to breed it, I don't think it should be in the gene pool. That for me is orthopedic diseases that are crippling. Hip dysplasia, elbow dysplasia, patellar luxation, all this stuff, legs perthus, all this stuff that happens orthopedically. And for me, that's things like seizures, because I think seizures are life-threatening. But that's my world. I live in a veterinary clinic. Remember, that's what I do every day. So I see dogs that come in with owners that are distressed, dogs that are dying, dogs that need to be euthanized. And so my perspective is going to be different than other people's perspectives because that's not the world they live in. They live in a whole different place. And you live in a different world than I do.
Well, and I think the world's, and remember I said the line in the sand that you scuff out?
Yes, because you have
And
to.
right. Well, I was telling you the story, and I think it's important for people to hear this. When I was a baby dog breeder, I had rules, man. Rules. I was never going to do this, and I was never going to do that, and I was always going to do this other thing. And you're making fireworks again. That's amazing. I was never only ever, now this is for wire-haired pointers, so again, that's part of the conversation. What is mandatory for wire-haired pointers in my mind, or should be, is not in certain cases for other breeds. So like Clumber Spaniels, for example, they've come a long way with the hips in Clumber Spaniels, but mild or a unilateral in a dog that is otherwise extraordinary, I'd breed it in a heartbeat.
Right.
Same with Spinoni, actually. I did do that. And so in wire hairs, I was only ever going to use good or excellent right up until I had two fantastic dogs that happened to be fair. Well, okay, I had to change the rules. Right. So, but there are things that in my mind, in my world, right, in Laura's world, there's all the things you said. Temperament, if then not only don't go in my breeding program, they go to heaven in my breeding program, my world. So everybody's world is their own, right? Obviously seizures, orthopedic, and then the important question, I think, and you might have some insight on this because people ask me this all the time, and I have my opinion, but I'd be curious if there's medical thought on it. Let's use seizures as an example. Okay, something you can't test for, all this sort of thing. I'm obviously not using a dog that seizes directly. I may or may not use its sire. I will probably use its sire and dam, although not necessarily together. I may or may not use a littermate, depending on what I have. what is your comfort level for things like that? And you get one seizure puppy, you have to wipe out the entire line.
Right. And there's so many causes for seizures that you can't just automatically say that this is epilepsy.
Mhm.
There can be Lafora disease, there can be brain tumors, there can be all kinds of other reasons that dogs have seizures. So
Mhm.
again, it has to be really, you have to remember you're breeding the whole dog.
Mhm.
You're not just breeding the testicles, you're not just breeding their seizures, you're breeding an entire dog and an entire line of dogs,
Family.
horizontal, vertical
Right.
pedigree, the whole thing. So it's really hard to say, I'm going to just throw this one dog out. You have to look at the whole dog and say, what great features, what great qualities does this dog bring to a breeding program? And what can I combine it with that is less likely to cause an issue? There is no guarantee in the dog world that you won't create a genetic problem. Humans are the most outcrossed species on the planet. We travel around the world to breed to each
Right.
other.
Right.
And we still have genetic disorders. My mom had hip dysplasia. My dad had allergies and was nearsighted. I
Right.
should not have been, they should not have bred. I shouldn't be here.
I am
So
spay for
here I
pet
am.
quality, so there you go.
Exactly.
I think more the question, and I know there's no hard and fast. I know what I will do, and I don't know if there's medical science to back up what I do. It's just what's comfortable to me. Another one is cancer, right? When you
Yeah.
start seeing too much cancer, popping up here and there, like I solved it with an outcross, but then I brought in some other thing, right? So
Yeah.
how do we talk about those kind of things to people who are just getting started and are terrified and never want to have a dog that's going to be sick and never want to make it somebody unhappy? Because
And
that's
never
not
breed. And never breed. I mean, there's just no other way around it. I was telling you earlier, Laura, that Dr. Ian Dunbar, a number of years ago, wrote for the AKC
right.
Gazette an article called The 7-Star Stud. And I have contacted Dr. Dunbar's son. I've contacted the AKC. I've looked through my file cabinets and I know somewhere I have it in a file, somewhere in the 8,000 file drawers that I have, somewhere it's in there, but I can't find it. So if anybody knows where this article is, there's a reward for this.
There is a
But basically,
reward. Send
yeah,
it to me or Marty. We will get you the
yes,
reward.
I will pay you a reward. But essentially what he said was, and I think it still holds true today, even though it was an article written probably 30 or 35 years ago, was essentially in your breed, in your line, in whatever you're working with for your genetics, pick the worst things that you have and get rid of those first.
Mhm.
So, and I think that's important that if it's a dysplastic situation or elbow dysplasia, hip dysplasia, whatever, you need to get rid of it in your line first. And then you try to every generation make it better and
Mhm.
better and better. But now we have things that tell us all these DNA things. We don't have a DNA test for cancer. We don't have diagnostics for some of these things, and we might not ever for a long time. Today, I was at the dog show. I bought ice cream from the Mariano fundraiser, and Yami Mariano is at the University of Minnesota, where I am, and they were doing a fundraiser to help some of his cancer research. There's research going on, but he's been doing this research for 20 some years. I was sending him lymph nodes 25 years ago when he was in Denver trying to figure out the DNA test for lymphoma. We still don't have one, and it's very frustrating to people. Lymphoma, osteosarcoma, hemangiosarcomas.
Angio. Yeah.
They're heartbreaking, relentless, terrible cancers. But if you say, I'm never going to breed a dog with this, and you have a golden retriever or a flat coat or a boxer or a burner, you're never going to breed. Like, you just have to accept that there's a certain amount of risk.
You
So
might
you
not
have to
breed
pick
the
the things
actual
that are worst.
one, and then at 9 it drops dead with mangio because and you can't not breed a dog until it's 9.
Right. It just doesn't work that way. So it is frustrating and it is difficult. And, the general public somehow thinks that magically we can make them all poof go away by careful breeding. And as much as I would love to tell you that that happens, it just doesn't. And the DNA tests, I think, in a lot of ways have made our lives harder because now we have things that we can test for like CDDY. And there's a whole array of people that are saying never breed a CDDY dog. Okay, I have had Pembroke Welsh Corgis for 35 years. Every single Corgi has 2 copies of the CDDY gene. If you don't have 2 copies of it and you're a Corgi, you're a collie. You're not a Corgi.
That was such a
So
great line. That was in the seminar too, and I'm like, that is just so perfect.
same with Bassets. If you don't have 2 CDDYs, you're a Beagle. So you have to get over the fact that certain things just travel with that
Right.
genetic marker, that genetic makeup of that dog. So get over it. Do the best you can. Pick the best dogs you can. Talk to the people that you can and hope they're being honest with you. And then turn around and be honest with them. If
Yeah.
you have created a genetic issue, it's not your fault, but don't hide it. Be honest with, now that doesn't mean put it on Facebook and dish anybody. It just means if somebody says, I'd like to use your stud dog, be honest with them. If you have allergies, tell them you have a line of dogs with allergies. I had a very nice geneticist say to me, I really like some of your dogs, and my foundation bitch doesn't have pretty feet. Okay, I'm going to get over not having pretty feet, because you don't die from not having pretty feet. She's still sound as the day is long. She's 12 this week. She's still sound as the day is long. But pick the things that are the biggest issues first, because you can't have a perfect dog. The only dog that's perfect is, I saw a video of one that went out into the garage and got a pooper scooper and cleaned up its own poop and then threw it away. I'll share the video if you'd like to. It was a pretty hysterically well trained. I think it was a Malinois. I know
It's got to be a
great
Malinois.
video.
Just
It was a
gotta
great video.
Totally.
But there is no perfect dog. So the reality is you have to do the best you can. You be honest with people, be honest with yourself. If you can't look yourself in the mirror, if you can't follow your breed club's ethics, then maybe you shouldn't be breeding. But the honest truth is you're going to have things that go wrong in a breeding program. No matter how hard you try, you're going to have a puppy that dies. You're going to have a genetic disease that pops up. And yes, outcrossing has the advantage of bringing in new genetics and perhaps getting rid of something. But oh my God, you don't know what you're bringing in.
Trust me when I tell you, the nightmares. And, I think that, and again, back to our worlds, like for me, I've got a bird dog. Entropia, it's not a thing we see in our breed. And when I see it turn up one generation and then the next in a family, I'm like, that's it. We're done. Like I'm not playing with this.
Yeah.
Right.
And I've seen bites go the same way. Bites a bad bite can be painful for the dog. And so for me, that's in a class 3. And so if I've had a client, I haven't had problems with it in my own line, but I've had clients with it. Remember, I counsel clients every day, all day long about what I should do with my genetic program. And if I see something like that, I'm like, okay, or temperament or whatever, I'm like, okay, back up here. Let's figure out, where did this come from? And let's go somewhere else. Like, don't do this breeding to the male and female again together. Figure out something else, bring in another dog, but ask for some honesty out of the people that you're breeding with, because you may be gobsmacked by something else.
Well, and I think, the other part of this that I think is really important that I don't believe enough people truly grasp. When I breed my dog, I'm just going to use mine because it's easier and I don't have to call anybody out. When I breed my dogs in a certain direction, like this family and this family, I know Nick. Like, I don't have problems. Like, I have good health. My first litter had 3 OFA excellence, right? Never a bad heart, whatever. I breed it over here into this family of dogs that's completely separate. It's like its own line bred family of dogs. You want to do an outcross, you go to that family. Holy crap. On a cracker, the disasters, like disaster after disaster after disaster after disaster, and multiple efforts in multiple directions of that family have been disastrous, that in its own family they don't have.
It just doesn't mix well.
Families don't mix, and I think that is something poorly understood. Like, you blame everything on the stud dog. It's always the stud dog's fault. Never breed to that dog. It makes XYZ. Well, it only made XYZ with your line. With this line, it did just fine.
I know.
Right?
I know. And it's confusing and it's difficult. And the more we know about DNA and the more we know about OFA testing and all these other things, I think it gets even more frustrating, because you feel like you should be improving things and you still are battling this issue. So it does become an issue. I mean, we have all kinds of great screening tests. We have all kinds of cool things that we can do. And all we can do is reach into that giant jelly bean jar of the colored jelly beans, grab a handful, and hope that the right colors come out when you do it, because you just don't know what's going to mix and match correctly. And we don't know yet. Are we going to know more in 10 years and in 20 years? Oh, I can't even imagine, based on because I remember when I went to the first lecture that Elaine Ostrander gave at the AVMA about the canine genome. And I'm in the room, there's like 10 people in the room. It's this giant lecture room. And there's 10 people in the room.
Elaine Ostrander's first, oh my God.
I know. And I was sitting in the room just thinking,
for that.
Oh, I had no idea what she was talking about. She was talking about SNPs and all this stuff. And I'm like, I don't even know what these words are. But I knew she was magical. It was cool. And I was, but the only other people in the room were the scientists, not the practitioners. Because they all understood what she was talking about. And I was just like, wide-eyed and just, like blown away by this stuff. But look how far we've come in a very short period of time. And it's just going to keep getting better and better. AI and all kinds of things are going to make it better. But you still have to deal with the general public who doesn't understand. And these are the people who call you out on Facebook and say, "What are you doing breeding a dog with CDDY?" Seriously, 38% of this line of dogs, of this breed of dogs, has CDDY. And if we don't breed that 38%, we just chopped a third of our gene pool out. And now we're going to end up in bigger trouble. We're going to back ourselves into a corner. We're going to have a bottleneck. We're going to have all kinds of issues. So we have to be smart about this. So be honest with each other. Be smart about it. Use carriers. We can use carriers in a breeding program. So don't throw out your carriers. I mean, I can't emphasize some of these things enough. But if you have a question, find a mentor in your breed that knows what's going on. Find a mentor not in your breed, but has something comparable, because a lot of breeds will have similar issues. Or talk to the people at the DNA companies, talk to the veterinarians that you work with, talk to your geneticists. There are people out there that can help you. So don't feel like you have to go this alone, but be smart about it. If it didn't work the first time you did it, don't do it again.
Dear God, don't do it again. And don't do it in that family, right? I mean, that's the biggest thing that I have a hard time convincing people, like, listen, it didn't work. It's not going to work next time.
Yeah. It's bad. So keep good records so that you know. Get photographs, use Carmen Battaglia's stick dog program. Talk to people.
I do like, I think that one of the, again, our Pedigrees to Pups seminar, we talked about a lot of different resources and a lot of different things. And Carmen's program, his stick dog program, is really interesting and a really great way to think about that. So if you guys are unfamiliar, betterbreeder.org, I think.
Breeding Better Dogs, I think is what it is.
Breeding Better Dogs. Yeah, I think that's what it is. Or come to one of our seminars. P.S. Whoop, whoop.
Oh, yeah. Come to a seminar.
We're going to have one in Hawaii. Should be a blast. We're going to have one in Wisconsin. Should also be a blast. And just as a final closing note, if you enjoyed just Marty and Laura riffing, check out the Marty and Laura show, because that's pretty much our MO at the Marty and Laura show. And I think that you guys will enjoy it. I know your puppy people will, and your brother's cousin's uncle's girlfriend. So, all right. Thanks, Marty. Sure appreciate it. Don't cook there in Minnesota. I worry about y'all.
Yeah, we'll be fine.
Okay. Peace out, yo.